to our channel. Today, we're going to break down why you should test your cholesterol starting at early ages and how often you should get checked to keep your heart healthy. Did you know that heart disease starts long before you feel any symptoms? It all begins with cholesterol, and many people have no idea until it's too late. Cholesterol testing is one of the most important tools for maintaining long-term heart health. High cholesterol is a major risk factor for cardiovascular diseases, CVDs, such as heart attacks and strokes, and understanding when and how often to test for it can prevent serious complications. Despite this, many people overlook the importance of early cholesterol testing. This video delves into why you should start testing cholesterol early, the optimal age to begin, and how frequently it should be done to ensure a lifetime of heart health. Understanding cholesterol, the basics. Before diving into when to test for cholesterol and how often, it's crucial to understand what cholesterol is and why it's so important for your health. What is cholesterol? Cholesterol is a waxy substance found in your blood, and it's vital for building cells and producing hormones. However, not all cholesterol is created equal. There are two main types. Low-density lipoprotein, LDL, often referred to as bad cholesterol, contributes to the buildup of plaque in arteries, leading to narrowing and potential blockages. High-density lipoprotein, HDL, known as good cholesterol, helps remove LDL from the bloodstream, preventing plaque buildup. Why cholesterol matters for heart health. High levels of LDL cholesterol can lead to atherosclerosis, a condition where plaque builds up on the walls of arteries, making it difficult for blood to flow efficiently. Over time, this can result in serious cardiovascular issues such as heart disease and strokes. Maintaining a healthy balance of LDL and HDL is crucial for reducing the risk of these diseases. The importance of early cholesterol testing. One of the biggest mistakes people make regarding cholesterol management is waiting too long to get tested. Many believe cholesterol testing is only necessary later in life, but evidence shows that early testing can play a significant role in preventing heart disease. Here's why. 1. Cholesterol levels can rise in youth. Many people think of high cholesterol as a problem that arises in middle age, but research shows that cholesterol levels can begin to rise during childhood and adolescence. While genetic factors often influence early cholesterol levels, lifestyle choices such as diet, physical activity, and smoking can also contribute. By the time someone reaches their 30s or 40s, cholesterol may already be at dangerous levels, which could have been managed if caught earlier. Early testing allows for intervention before the problem worsens, offering a better chance of controlling cholesterol through lifestyle changes rather than medication. Preventive care is key. Heart disease is the leading cause of death worldwide, but it is also highly preventable. Early cholesterol testing provides an opportunity to detect abnormal cholesterol levels before any symptoms of heart disease emerge. By identifying high cholesterol early, individuals can take steps to modify their diet, exercise routine, and, in some cases, begin medication to prevent long-term damage. Genetic factors play a role. Family history is a strong indicator of your risk for high cholesterol. Conditions like familial hypercholesterolemia, which results in high cholesterol levels even in childhood, increase the risk of heart disease at an earlier age. Individuals with a family history of heart disease or high cholesterol should consider testing much earlier than those without such a background. Long-term benefits of early monitoring. Monitoring cholesterol levels from a young age allows you to track changes over time. Understanding your cholesterol trends can help you and your healthcare provider make informed decisions about your heart health. Early data can also serve as a baseline, helping doctors assess whether changes in lifestyle or medications are effective. The right age to begin cholesterol testing. The general recommendation for cholesterol testing varies depending on your risk factors, lifestyle, and family history. However, there are general guidelines based on age groups that can help you determine when to begin cholesterol testing. Children and adolescents, ages 9 to 11. The American Academy of Pediatrics recommends that children have their cholesterol levels checked at least once between ages 9 and 11. This may come as a surprise, but studies show that high cholesterol can begin early in life due to genetics or lifestyle factors like poor diet or lack of exercise. Children with a family history of high cholesterol or premature heart disease may need to begin testing even earlier, around age 2. The idea is to identify any potential risk factors before they lead to more serious issues later in life. Young adults, ages 20 to 35. For those without any significant risk factors for heart disease, cholesterol testing should begin at age 20. If cholesterol levels are normal, testing should occur every 4 to 6 years. However, if a young adult is at risk due to smoking, obesity, or a family history of heart disease, more frequent testing may be necessary. This period is crucial because many people in their 20s and 30s feel invincible when it comes to their health. Early testing in young adulthood helps to instill good habits and ensures that high cholesterol doesn't silently develop into a bigger problem. Adults, ages 35 to 45. For men, cholesterol testing becomes even more critical between the ages of 35 and 45. Studies show that men are at a higher risk of developing heart disease earlier in life compared to women, partly due to naturally higher levels of LDL cholesterol. Regular testing is important during this period, and doctors may recommend lifestyle changes or medications depending on the results. For women, cholesterol levels typically begin to rise after menopause, which is why testing becomes more crucial after age 45. This rise is associated with a decrease in estrogen levels, which previously helped keep cholesterol levels in check. Middle-aged adults, ages 45 to 65. By middle age, cholesterol testing should be routine for everyone. For adults aged 45 to 65, it's recommended to get tested at least every 1 to 2 years. If risk factors are present, such as obesity, diabetes, smoking, or a family history of heart disease, your doctor may advise more frequent testing. For women, the age of 55 is particularly important because of the increased heart disease risk following menopause. Men over the age of 45 are also at higher risk of developing cardiovascular disease, making frequent cholesterol testing vital. Seniors, ages 65 and older. Even though seniors may already be under medical supervision for other conditions, cholesterol testing remains important. At this stage, cholesterol levels should be monitored annually or biannually, depending on the individual's health status and risk factors. Factors that influence cholesterol levels. Understanding the factors that influence your cholesterol levels can help you manage them more effectively. While age is a key factor, there are several lifestyle and genetic components that play significant roles in determining your cholesterol levels. Diet. Eating foods high in saturated and trans fats can raise your LDL cholesterol. Conversely, a diet rich in fruits, vegetables, whole grains, and lean proteins can help lower cholesterol levels. Physical activity. Regular exercise helps raise HDL cholesterol, the good cholesterol, and lowers LDL cholesterol. It also helps with weight management, another important factor in maintaining healthy cholesterol levels. Smoking. Smoking has numerous harmful effects on heart health, including lowering HDL cholesterol. Quitting smoking can improve your cholesterol levels and reduce your risk of heart disease. Weight. Being overweight or obese increases your risk of high cholesterol. Losing even a small amount of weight can help lower LDL cholesterol and increase HDL cholesterol. Alcohol consumption. Moderate alcohol consumption may have some heart benefits, particularly by raising HDL cholesterol. However, excessive drinking can lead to high cholesterol and other heart-related issues. Genetics. Some people inherit genes that make it difficult to process cholesterol properly, leading to high cholesterol levels even with a healthy lifestyle. Conditions such as familial hypercholesterolemia are caused by inherited genetic mutations that lead to high LDL cholesterol from a young age. How often should you test your cholesterol? Cholesterol testing frequency should be based on individual risk factors, age, and cholesterol history. Here are some general guidelines. Low-risk individuals. For those with no family history of heart disease, no significant risk factors, and normal cholesterol levels, testing every 4 to 6 years is generally sufficient. This applies mostly to young adults and those with healthy lifestyles. Moderate-risk individuals. Individuals with moderate risk factors, such as being overweight, smoking, or having a family history of heart disease, should have their cholesterol checked every 1 to 2 years. People with a history of slightly elevated cholesterol levels also fall into this category. High-risk individuals. For high-risk individuals, such as those with diabetes, high blood pressure, or a significant family history of cardiovascular disease, cholesterol testing should be done more frequently, typically annually, or as recommended by a healthcare provider. People already taking cholesterol medications. If you are already on medication to manage high cholesterol, your doctor may recommend more frequent testing to monitor the effectiveness of the treatment and make adjustments if necessary. Knowing these numbers helps you and your healthcare provider make proactive decisions to improve heart health. In conclusion, by regularly monitoring your cholesterol levels and understanding the results of your lipid panel, you can take proactive steps to manage and reduce your risk of cardiovascular diseases. Simple lifestyle changes, such as improving your diet, increasing physical activity, and quitting smoking, can significantly impact your cholesterol levels. Additionally, for those with high cholesterol, medication like statins may be prescribed to help lower LDL levels and prevent plaque buildup in arteries. The earlier you start testing and tracking your cholesterol, the more control you have over your heart health, ultimately reducing the risk of heart attacks, strokes, and other cardiovascular complications. Did you find this video helpful? If so, give it a thumbs up and share it with someone who could benefit. Don't forget to subscribe for more wellness tips and hit the notification bell so you're always in the loop. Have any tips or experiences to share? Drop them in the comments, we'd love to hear from you. Thank you for watching and being a part of our amazing community. Your support means the world to us, and we can't wait to bring you more valuable content soon.